Today on Feelin Good, sponsored by Warren County Community Services. I'm your host, Shelly Abrams, and today we are going to be talking about a variety of topics that I think will enlighten you. I know that when I've talked with our three guests over the past few weeks, they have enlightened me for sure. So I hope that that this will be good conversation for you to learn and just listen to. And on that note, our first guest today is Melissa Deaver. Mm-hmm. Melissa is coming to us from the Alzheimer's Association.
Yep.
And welcome.
Thank you. Thank you so much for having me.
I am delighted that you were able to be here today. I read an article in the Journal News, mm-hmm. and I believe Edwina Clark had written it. And actually, I knew of Edwina through the Journal News when mm-hmm. she was in Middletown, and I was with the chamber in Middletown. And I contacted her, and she said, you were the person that we should get in contact with for Alzheimer update.
Yep.
And I remember specifically when I called you, and I've got the ARP bulletin here, that the breakthrough for Alzheimer's had just been announced on the news.
Yes.
And I pulled out the article from the ARP bulletin right here, and I brought it with me. And I know that there have been many different news items about Alzheimer's and the update. So before we dig into the updated information, tell us a little bit about you.
Okay.
And about your connection with the Alzheimer's Association.
Okay. Well, as you said, my name is Melissa Deaver, and I'm the program director with the Alzheimer's Association with the Greater Cincinnati chapter. I'm a licensed social worker, and I've been with the Alzheimer's Association for 11 years, and I've been a social worker for a little over 20. We don't have to get into details and reveal my age, but yeah, for a little over 20. And I have a connection with Alzheimer's disease because my grandmother passed away of Alzheimer's disease, and so did my great-grandmother. So it's naturally something our family is very concerned about, and we definitely have a vested interest in Alzheimer's disease.
Well, tell me this. We hear so many references to Alzheimer's, to dementia. Would you differentiate between the two or elaborate on the connection?
Yes, absolutely, and that's a great question because that's something we get asked so many times that people do confuse the terms dementia and Alzheimer's. So dementia is really just an umbrella term that describes a variety of conditions that cause cognitive impairment. So when somebody says that, I have a diagnosis of dementia, that just means that the physician is saying, yes, I'm seeing cognitive issues that's interfering with your daily life, but I'm really not telling you the why. So it's like telling somebody they have cancer, but you're not telling them what type of cancer. So Alzheimer's is a type of dementia, and it's the most common type of dementia, but there are many, many other types of dementia that exist. So, for instance, vascular dementia is a fairly common type of dementia, and that's, folks who have had some kind of cerebrovascular insufficiency. So you've had a stroke, maybe you've had blockages and you weren't getting proper oxygen and blood flow to your brain, and so now you have this vascular dementia. There's also Lewy body dementia, which is kind of a combination between Parkinson's and Alzheimer's disease, all rolled into one. Frontotemporal dementia, which affects the frontal lobes of the brain, just like it implies. And we could just go on and on with all the different types, but those are some of the more common types that folks may hear about.
When we hear about all these different types, as you were mentioning, has this been years in the making in terms of recent studies? how far back does it go? I mean, I'm thinking back to my grandparents' age. I don't know that I ever heard any of those terms.
Right. Exactly.
And that would have been in the, 70s, 80s, 1970s, 1980s. But tell us a little bit more about the history, possibly, of Alzheimer's, for instance.
And many people have heard about Dr. Alois Alzheimer's. And he is the one that first diagnosed and discovered it in a lady who was actually in her 50s. And at that time, people thought that she was mentally ill because of her behaviors, because of her age. As we've kind of came along in time, it's still been a very unrecognized disease. Even back kind of even before the time frame that you're referring to, people with Alzheimer's disease were put in psychiatric institutions. They were given shock treatments because it was so misunderstood and seen as a mental illness. I even can think about, like you're saying, grandparents, people called this hardening of the arteries.
Okay.
We didn't call it Alzheimer's disease. We didn't. So really, not until more recent times, probably more in the 80s, would you say that people started using the term Alzheimer's more and actually identifying it. And then much more recently, have we started really talking about the different types of dementia. Researchers have known it's there, of course, but, modern medicine and just talking to your family doctor, you didn't talk about the different kinds of dementia. It was just Alzheimer's. And, really that's kind of sad because I think a lot of people have been misdiagnosed and been slapped with the Alzheimer's diagnosis when maybe it really is Lewy body or vascular or something else, that's causing their cognitive issue.
Okay. Well, now you said you were in charge of programming for the Alzheimer's Association. What types of programming do you offer?
Okay. So all of our programs and services are free. And that is made possible because we get funding from the Ohio Department of Aging and our Alzheimer's Walk. And we help folks with any kind of dementia. So it doesn't have to be Alzheimer's. It could be just dementia unspecified, or maybe it's Lewy body, or maybe you don't even have a diagnosis yet, but you have a concern and you want to talk to somebody. So what we have, one of my favorite things that we offer is our family care consultation. And so that's where one of our nurses or social workers meet with the family and help them understand the disease, what's going on, what to expect next, how to prepare, how to deal with the behaviors you may encounter, how to communicate with that person, what resources are out there to help you care for the person now, and what do you need to think about down the road. So it's really a big care planning session. And we also address legal and financial planning, which is hugely important. So just a big free care planning session. And then we also have community education programs, which through COVID, a lot of that became Zoom and online out of necessity, but we're starting to get back out in the community now. But these are programs to help professionals, families, caregivers understand the disease. And so we talk about, behaviors, communication, the stages of the disease, all the different types of dementia. And then we actually have an expert series where we use our friends in the community who are experts, and they may come in and talk about, maybe a speech therapist may elaborate more on making a communication plan, or we may have one of our local physicians talk about, drilling down to getting that diagnosis. So just about any topic you can think of related to dementia, we're covering it, and we have an education program for that. We also have support groups that meet almost every day of the week. We have a support group going on somewhere, and some of those are Zoom and some of those are in person, but that's for caregivers to come to and really get to talk to somebody that knows exactly what they're going through, because they're just like them. There is nothing that you're going to say that they don't understand or haven't experienced. And I think that's what caregivers struggle with, is that they can't always say to their friends or family like, wow, I get so frustrated sometimes I lose my temper. But they could totally say that to a fellow caregiver, and they're going to say, oh yeah, I've done that too.
Right.
Don't feel bad, that's normal.
Right.
So that's what those support groups, are for. And then we have our helpline. We have a 24-hour helpline that if you can't reach somebody at our local office, there's going to be a master's level social worker at our contact center that people can call if it's 2 o'clock in the morning and your loved one with dementia is trying to wander away and you don't know what to do. Somebody's going to talk you through that.
What would that helpline number be?
That is 1-800-272-3900. And you can also use that number to even get to our local office. If you say, hey, I want to talk to Melissa Deaver at the local office, they will connect you. But I love that it's 24 hours. Anytime you have a need, somebody's going to be there. And, caregivers sometimes can't call during the day when they're providing care.
Right.
Sometimes midnight is the best time for them.
And caregivers probably need as much assistance with just their own self-care when they're trying to, help a loved one with the journey
Yes.
that they're on as well. So they could find resources
Oh,
with
yes.
you as
And,
well.
and somebody just to even talk to and hear you and validate your feelings and understand
Right.
what you're going through. And that's exactly what we're there for. I mean, unfortunately, at this time, we can't take away the disease, but what we can do is we can be there to support the caregiver to help them get through this journey. And it's hugely important that the caregiver takes care of themselves, because we have statistics that have shown that often caregivers pass away before the person with the disease because they're so stressed, they're neglecting their health, they're not going to the doctor as they should, and sometimes it costs them their life.
Well, the update, I know that it seemed that, there was a potential medication.
Yes.
Could you elaborate on that announcement and then subsequent to that announcement where we are today?
Yes, absolutely. So some people may have heard it called Aduhelm, aducanumab. That's the same medication, and it's certainly not a miracle cure or a miracle drug, but what it does is it's giving people hope. And what we have found is it helps people in the early stages of the disease to slow the progression of the disease. And that is something that we have never had in all the history of research and medications. We've never had a drug that actually slows the disease. All we've really had are what you would want to call a Band-Aid that kind of masks the signs and symptoms for a while. So it's really exciting that we have something like this available. And yes, it's only for early stage, and that's kind of a bummer. But we know that once the disease has progressed to a point and damaged the brain so badly that sometimes you can't help it. It's so
Okay.
It's so deteriorated that it's really hard to help that brain. And so, that's why I think the medication is so much more effective in the earlier stage, because not as much damage, has occurred and not as much deterioration. And, as you said, there's definitely controversy around the drug and side effects, and people have concerns about that. But I really want folks to think about, when we talk about HIV, back in the 80s, I remember that was a death sentence.
Right.
You got HIV, it was over, it was done. And because of research, look at where we're at now. We have people living with this disease, and you hardly even hear about people passing away of that disease, but it took time to get there. They went through many medications, many research before they finally found the magic bullet. And really their magic bullet was a cocktail of medications. And we really think that that's what is going to be the case with Alzheimer's disease as well, because we're trying to target tau protein, we're trying to target beta amyloid. And so I don't know that one medication is just going to take care of all that. We really think it's going to be a cocktail. But we're really excited just to even have this available, even though there could be negative side effects. And, that is for individuals to talk to their family physician and figure out, is this is this the best choice for me? You know, is this really going to help me? But what I want folks to think about is this. You know, we are talking about a disease that there is no cure for. We know what's going to happen as it progresses. You know, we know we can't change that. And so sometimes you're really thinking about the risk and benefits, and you've got to weigh that out when you're talking about considering something like this. So that's where we're at now. I mean, the drug is out there. It's still being utilized, and some physicians and clinics are choosing to utilize it, and some aren't, and that's okay. You know, some folks are choosing to try it and some aren't, and that's okay too. But we are moving forward with it, but it is more for the early stage folks.
Okay, very good information. You did make a slight reference to the Alzheimer's walk, and that helps with funding.
Yes.
For your programs, and I'm sure for research.
Oh, yes.
As well. So tell us more about the Alzheimer's Walk, and if there are any upcoming events that you would like to promote.
Yes, thank you so much. Yes, we do have the walks coming up right around the corner this fall. We have several throughout the greater Cincinnati area, and we cover 37 counties. So we have walks spread all across our 37 counties, but we would love for people to get involved, especially if you're somebody out there that has been touched by this disease and you have felt helpless and felt like, I want to do something, but I don't know what to do. This is your chance, because that money is going to research, and we need it, right? We need it so we can keep finding better medications and better cures. And so we desperately need your help. So if you do want to be involved in a walk, you can visit our website at alz.org/Cincinnati, and that will take you right to our walk page, and you can choose what walk would be best for you.
Okay,
and you don't have to walk. If you say that, oh my gosh, I can't physically move, that's okay. It's just being a part of something, raising awareness, raising money, and helping us advance the cause. And then another program that we do have coming up that I really want to talk about is, and I will actually be presenting on this one. It's going to be on August the 30th. And it's the Sandwich Generation program that we're doing. And it's something that really we haven't addressed much, but it's happening. And, it's people that are in their late 30s, 40s, 50s that are, now finding themselves caring for mom or dad who have dementia, but are also caring for their children and trying to work. And so you're really caught in that sandwich generation. And so we want to try to help folks think about, right now everybody's planning for their children to go back to school, but are you thinking about what would you do if mom or dad was diagnosed with dementia? And you need to plan, because so many people have had to stop working, reduce their hours because they couldn't manage it all. So getting that plan in place so that it doesn't just really throw your life, out of kilter. So we're going to have an education program on that at the end of August, and folks can visit alz.org/CRF, and that'll take you right to our website to register for that, or they can call 1-800-272-3900, and they will get you registered as well.
Well, just in this short amount of time, you have definitely enlightened us on the possibilities that are to come, some of the history, and some of the helps that are available. So I hope that our audience takes note of what we've been discussing, and not to fear it.
Yes.
But be educated, be informed, and know that help is out there.
Yes, absolutely. And that's what we want to do. Give folks hope, give them help, and be there to hold their hand while they are going through this journey, and help them avoid a crisis situation, because that doesn't have to happen.
Very good. Well, Melissa, thanks so much for spending time with us today on Feelin Good, and we hope to keep in touch and hear from you soon.
Yes, thank you so much for having me. It's been my pleasure.
Very good. Thanks.
Thank you.
Jennifer Lake.
Hi.
We are so delighted that you are joining us today from Council on Aging of Southwest Ohio.
Correct.
Correct?
Yes.
And as we were chatting earlier, we have had a variety of topics presented by different members of Council on Aging in the past here on Feeling Good. And I'm delighted to meet you.
Yeah, it's a pleasure to be here. I'm so excited to be able to talk to you about the Senior Farmers Market program.
Well, when I heard about the Senior Farmers Market program, I thought, well, there's something I've never really heard of before. So please tell our viewers about you, about your connection with Council on Aging, and then feel free to elaborate on the farmers market for seniors.
Okay. So I am a registered dietitian by trade. I've worked in several different arenas. I've worked in long-term care, I've worked in hospital settings, I've worked in public health. My passion is to serve the seniors. I absolutely love making sure that they have a good quality of life. With Council on Aging, my title is called Nutrition Business Relations Partner. So I kind of act as the liaison between some of our providers that do programs such as home delivered meals or congregate meals, nutrition counseling. So I'm kind of that go-between person between the care managers that set up the programs and the providers that actually do the actual service delivery. So with Council on Aging, I've been with them for a little over 3 years. We do all kinds of programs to be able to help keep the seniors in their homes as long as possible, as long as they are able to live independently and have that good quality of life. The Senior Farmers Market program is such an exciting program, and it is new to the Southwest Ohio region.
Okay.
This is our second year participating in the program. It is supported or funded through the USDA, and that money is filtered through the Ohio Department of Aging, and we were able to secure funding in order to bring the program down to this area. So we are able to accept applications from seniors and provide coupon vouchers that they can take to the farmers markets throughout our region, which is Hamilton County, Butler County, Warren County, Clinton, and Claremont County. So we have a 5-county region. So once they apply for the program and receive their coupons, they can take those coupons and buy fresh fruits and vegetables. They can buy honey and fresh cut herbs that they can use in the food preparation of those fresh fruits and vegetables.
So this is a plan that folks could apply for. And if they are chosen by the program, then the coupons can be taken to any farmer's market or a specific?
Yes, so they have to be a
market?
participating farmer's market.
Okay,
So
okay.
in order for a farmer's market to participate and be able to accept those coupons, they had to go through a training process, and that was just to learn about all of the rules and the regulations of the program, so that we are not only providing fresh fruits and vegetables for the seniors in our area, we are also supporting the local farm movement as well. So these items that they're able to purchase with the coupons need to be grown locally, whether that's grown by the actual farmer that's selling them, or if that farmer is purchasing some supplemental items, they have to be able to purchase those from the surrounding area. So it's definitely a win-win, situation. So we're supporting the local farmers by getting those fresh fruits and vegetables into the hands of the seniors.
Great, great. Well, it's a newer program. You
Yes.
mentioned that, and I noticed you have a beautiful brochure there. Tell us a little bit about what the brochure will show us.
Yeah, so this is a copy of the brochure. This is something that each applicant will receive in their packet with their coupons, and it's nice because the identification of the program at the farmers market, there is a poster that looks very similar to this brochure. So this is kind of eye-catching, so that the seniors can see this at the farmers market and think, oh, this is where I can use my coupons. There's lots of great information in here. It talks about how to shop safely. In the age that we're living in right now with the pandemic as it continues, there's some tips that talk about how to shop safely at farmers markets. And then on this side, it does mention all of the different items that are available and what time of the year that they are available. Because if you're looking for berries, you want to maybe shop earlier in the season. If you're looking for apples, you're going to be shopping a little bit later in the season.
Okay, very good. So could you give us an example of criteria?
Yes, so in order to qualify for the program, you need to be over the age of 60, and then you also need to meet an income guideline question. That is the same amount that you would qualify for any other type of benefit programs, and it is 185% of the poverty level. It's based on the number of people that live in your household. But if you've got more than one person in the household over the age of 60, each person can qualify for their own separate allotment of their coupons. So if you have a couple, or you have a parent and a child that reside in the same household, each person could qualify for $50 in the coupon vouchers.
Oh, okay, very good, very good. So tell us, just in terms of the quality of the food that this enables participants to purchase and consume, the impact on their overall health. What would you say as a nutritionist? How much does food really determine your overall wellness?
Yes. So nutrition is a very important part. It can be a very important part of your medical treatment plan. I think, that the old saying, you are what you eat, really is true, because what we put in our body is going to be able to allow our bodies to function properly. So fruits and vegetables are full of all kinds of vitamins and minerals. They are very colorful. And so we like to say, eat the rainbow. A variety is just as important as the quantity. So some fruits and vegetables might provide vitamin A and others might provide vitamin C. So you want to make sure that you get a variety, because each one of those vitamins and minerals does something different in our body. So eating a very healthy diet can help keep your skin healthy. It can help, maybe not prevent diseases, but it might lessen complications from different disease states. If you've got issues, cardiac issues, or you have diabetes, or you've got, issues with your kidneys. Eating a very healthy diet can certainly help alleviate some of those complications.
Have you found any studies that pertain to mental health, well-being, in terms of maybe the dementia issue that we were discussing earlier, or Alzheimer's? Have you found any connection between the diet and any of those specific, kinds of mental health issues?
Yeah, so it's real hard to kind of pinpoint into one particular study that might lead to, but making sure that as we age, making sure that you're eating healthy at a very young age, and as we continue to age, it's very important to make sure that you are eating healthy, because I think in the long run there are some effects that it can be, preventing or maybe pushing that off a little bit further, in the progression state of some of those diseases.
Okay. Did I see a headline just recently that Council on Aging was moving?
Yes, so Council on Aging is moving their headquarters. Currently we are located in the Tri-County area. They have secured a property in the Blue Ash area. That location is going to be wonderful because it's going to be located in an area that's going to be easily accessible to all of our providers. It's going to be accessible to the public if they need to come and discuss some different services that we have available.
Okay, great. Well, do you have other upcoming events or ongoing events that you would like to tell our viewers about?
As far as in particular with the farmers market program, I'm kind of making my rounds to the different markets. And you mentioned before about being a participating market. So we have about 20 farmers markets that are participating in the program, and that's throughout the 5-county area. So I will be making my rounds at the different markets. So if if they happen to catch me there, I'm able to give coupons out right then and there. If not, they're able to secure an application from the actual farmers markets for that. Other outreach programs will be continuing to happen while we're in this moving process. There might be a little bit of a delay on any of the other events that we might currently be hosting.
I know that we wanted to talk together and get this on our show before the farmers market season was coming to a close.
Right.
So we should be in pretty good timely manner, shouldn't we?
Right, absolutely,
for farmers
absolutely.
markets?
So the farmers market, our program goes all the way through the end of October. So anyone who receives the coupons is able to use those coupons all the way up through October. And just to mention a little bit about the coupons, they're in $5 increments. So even though they're getting a total of $50, they're able to spend as little or as much at each visit. And I can tell you that just getting the response from some of these seniors from last year was overwhelmingly positive. A lot of them are very excited to go to a farmer's market. For some of them, they had never been to a farmer's market before, and they realize that there's lots to do at farmer's markets. And these farmers are very proud of their products, so they're very anxious and willing to talk about the produce that they're selling, give a lot of suggestions on different ways to prep the food, and even share some recipes.
Very good. Well, who came up? Do you remember how it even came up, the idea of starting the program?
So it is sponsored by the United States Department of Agriculture. I think, it was just identified that there is certainly a need because unfortunately for seniors that fall into that low income category, a lot of times they might have that difficult decision each month on where they spend their money. Do I pay for prescriptions or do I buy food? So this kind of maybe will alleviate some of that stress that these seniors have. As far as bringing it to our area, we had some local food advocates that said, hey, there's this program, why are we not participating? So we did some research and we found out that there was a way to apply and get funding. And to be honest with you, the very first year that we applied, we did not get approved for the program because the state just didn't have enough money to extend to all of the areas, all of the counties. So the second year we were able to secure that funding and we just ran with it. Even though it was a pandemic year last year, we were very successful in getting as many coupons out that we could, securing those farmers, and we were able to grow that program this year and incorporate more farmers markets and get more farmers involved.
Very good. Well, in case any farmers market owners or farmers that are growing produce are interested in becoming involved, could they contact you and say, we're currently not a farmers market on your list, but we'd like to be? Is there some kind of a process?
Yes, that would be
go through?
absolutely wonderful. If
Okay.
anybody is interested in becoming more familiar with the program guidelines and participating in the program, I encourage you to call Council on Aging. Our phone number is 513-721-1025. You can ask to speak to me personally. My name is Jennifer Lake, or you can just ask to speak to someone in regards to the Farmers Market program, and it will eventually get to me, and I would be happy to describe the program and see if you would be interested in participating.
Okay, very interesting. Well, your responsibilities, I'm sure, continue to grow as the senior population continues to grow, and all these innovative ideas and programs continue to grow. So
Right.
it's got to be a rather interesting arena for you, isn't
Oh, absolutely. When you look at the senior population, and I hate to say, but senior population can start at the age of 55 going into 60, which I'm right, real close to those guidelines, to that age group. The younger seniors have different views and different needs and different wants than some of our older seniors. So we are certainly balancing all of our programs and continuing to try and be innovative and looking for different areas out there that we're able to serve and to help those seniors.
Okay, very good. Well, do you have events that, fundraising events, or is all your funding done through like governmental types of things?
Yeah, so for Council on Aging in general, we have different funding groups or different funders available to us.
Okay.
So one of them is through the local Elderly Services Program, or ESP. You might
Okay.
be familiar with that. So that is a tax levy program. So when it comes up for renewal, Council on Aging is very active trying to get the word out, explaining what our programs are.
Right.
So that's one way that we get funding for that. So your local tax dollars can help fund programs to help serve the seniors. I encourage anybody to contact Council on Aging if you yourself are in that senior population, or maybe you're a caregiver for a parent or a neighbor, and just call and ask, what is available. This is my situation, and we can certainly be a good referral source to be able to get the information out to you to help. Some of our other funding sources do come through the governmental type agencies, like the Passport program.
Okay, very good. And in closing, contact information for our viewers to get a hold of Council on Aging.
Yeah, so you can call us at our phone number at area code 513-721-1025. You can email us, or you can look at our website and get email contact information. Our website is Help for Seniors, and that's the number 4. So it's help, the number 4, seniors.org.
Okay, very good. Well, thank you so much for bringing us this new program. And I don't feel so out of it, because I thought, how could this have been going on? And I've never heard of it before, but it's only relatively...
It's relatively new. It's just only our
new.
second year. So
Okay.
we're excited to be able to continue to grow it for years to come.
Very good. Well, thanks so much, Jennifer, for joining us today.
Okay.
And we look forward to maybe seeing you or seeing some of the farmers markets with your brochures.
Okay.
Okay,
Great.
thanks so much.
Thank you.
Welcome back. And we are delighted to welcome our next guest, Kristen Smith from Envision's Partnership in Hamilton, Ohio, correct?
Yes, absolutely.
I feel as if, even though we're meeting for the first time in person, I feel as if I know you because I first heard you speak at the Miami University ILR program. You were on a lunch and learn program via Zoom this last session.
Yeah.
And one of my very good friends, Marlene Essick, serves on your board, correct?
She is a very active member of the coalition.
Of the coalition. Well,
Yes.
explain to us, tell us about you, and
Okay.
then tell us about the coalition and how Envisions works
Yeah.
and your specialties.
Yeah, and we'll wrap it all around to what you just mentioned, how
Okay.
we first met each other.
Okay.
Yes, well, my name's Kristen Smith, and I am a prevention specialist. And working for Envision Partnerships is really a wonderful opportunity because Envision does 100% prevention work. We work in Butler County and surrounding areas, and prevention really can be described as sort of that active process of creating conditions and your own capacity for wellness, like your own personal attributes to promote wellness. So it really ties in well with your program.
Right, great.
And so one of the roles I play for Envision is the chair of the Butler County Suicide Prevention Coalition. And so Envision acts as an umbrella for this coalition, and we do lots of different work. One of those things being we present QPR presentations, and I'm a QPR trained instructor, as is the others, and Envision and in the coalition. There's special training you have to go through. but people who attend, like yourself, learned that QPR stands for Question, Persuade, and Refer. And it's a suicide prevention training. And suicide prevention is everyone's business. Sometimes there's a misnomer that, only counselors or whatever should be concerned about that. But it is like, how CPR is really important, because when someone has a heart attack, usually a doctor's not right at their side. It's a bystander rescue. The same thing happens with mental health crisis, right? A counselor isn't always right by the side, or some other mental health treatment person, but many times it's a friend, a family member, or even people that see each other on a regular basis, like coworkers or caregivers. There's lots of ways that we interact with each other in the community. And when we are familiar with the warning signs, we will know what to do. And so the training starts with dispelling the myth that by asking someone about suicide, you put the idea in their head. You can't do that. Only people who are already thinking of suicide are thinking of suicide. People who are depressed, if you ask them, you're not putting the idea in their head. And so that's a really big myth to dispel, because it helps give people courage to ask this question. And like I said, it is everyone's business to be doing this. Right now we're in a time where depression and anxiety has skyrocketed, and we want to essentially avoid suicides skyrocketing. And luckily over 2020 that did not happen. So the more people that are trained to Q, question, and then P, persuade someone to get help, because you can't just ask the question and leave it at that, right? It takes some active listening, being a good listener, opening up that conversation. Actually, it's been scientifically shown to decrease the anxiety that person is feeling. They feel cared for, right, when someone asks them. And then, of course, R is really important. It's refer. So looking to the resources that are in your community and knowing how to help someone get that help. Because many times people who are in a mental health crisis, whether it be a depression, even not thinking of suicide, but a depression, or a depression and somebody who is thinking about suicide, they're not in a state to initiate and get help for themselves. And so we, as the bystanders, the people that come alongside, can be that person for them.
Well, I remember getting back to the ILR program, the Institute of Learning and Retirement program. My friend who called upon you to present was a little concerned whether people would want to listen and want to hear about the program. And I wanted to hear about it because I have always been a prevention advocate in mental health issues, since my teaching days in the 70s. Just learning prevention across the board is such a powerful so much more powerful, I would say, in some ways, than waiting until the intervention stage. So I've always been an advocate of make mental health as common for a checkup as dental health is, and regard it as such.
I like that. Do you mind if I use that?
Please feel free. And it's been interesting with the Olympics happening the last week, this week, and so much more conversation about the impact of mental health on those Olympians, I'm sure on their families, on their friends, on public, that the discussion is becoming much more accepted, and I think people are addressing it as as a wellness issue overall.
Yes. Yes, I think, the Olympics are, it brings a whole world together, and certainly our nation can, it's a topic of discussion, like you mentioned, and its effects go way beyond the Olympians, but sometimes we put them on a special pedestal, not just their medal pedestals, but that they are beyond that, and no one really is beyond that. And there are ways of self-care, and there's been more of a focus on that during the pandemic too. So I'm very hopeful. I'm hopeful that this country is more accepting, and there's some stigma reduction happening right now, because that's part of the training as well, is to sort of dispel myths and reduce stigma surrounding mental health problems and suicide. Suicide is a preventable disease. We can do it. So.
Well, we were talking about diseases of, across the ages, and the impact of nutrition and produce from farmers markets, and the three of you being on today, how the interweaving of your messages is really rather amazing. Would you comment on the ways in which you see total overall wellness as it's related to diet, for instance?
Well, instantly my mind went to SAMHSA's 8 dimensions of wellness. That is something that it's a really strong program and a way of thinking about wellness, that we no longer think of it as just physical wellness, but we include emotional and social and even financial and environmental. There's a whole, it's like a little wheel of wellness, and certainly all of them interplay with each other. So people who aren't getting the right diet, for example, especially, I was talking to some of your guests before the show, that can impact their mental health, and so all of the different dimensions have to be cared for and addressed, for sure. Another thing that I think is a good tie-in with what we're talking about right now, which is suicide prevention, is many times in the elderly population, there's a lot of stress on the caregivers, and there's stress on the elderly, and especially during this pandemic, when some people have felt vulnerable, more isolated during this time. We have to keep our eyes out for warning signs. And so, like I said, the QPR training does a great job at helping people really know what to be looking for, because we can prevent suicide as a group, all of us. It's everyone's business.
So as our audience watches today and they feel as if they would like to find out more information about the QPR program and resources available and so forth, tell us a little bit about your upcoming event, and then the contact information, where they could go for, contacting you, or is there a helpline available, that type of thing?
Absolutely.
Okay.
Well, since we've been talking about QPR, I'll address that first. We offer about 2 trainings per month, and they'll be offered virtually. Our next training is a virtual training on August 23rd. It's in the evening from 6 to 8, and so that is a way that people can engage, especially in that virtual platform. You mentioned before, you wondered if during that lunch and learn how many of your friends and folks would engage, and there were people that did it. It's a little less intimidating, but people can do that by going to our website, envisionpartnerships.org. Envision is spelled with an E and ends with an S. Maybe we'll have some information on the screen so people will see how to sign up.
Okay.
There's also an event that you alluded to, a Walk to Remember. And this is a special remembrance event. It is not a fundraising walk. It is simply a chance for the community to come together and support each other, get resources, whatnot, if they have been touched by suicide in any way. Maybe they have lost a loved one. Maybe they have made an attempt. Maybe they know someone who's made an attempt. Maybe a family comes together that there's been suicide attempt in the past. And we want this, this is our third annual event. This is really organized and put on by the coalition. And last year we had it at Pyramid Hill. It was a fabulous event. This year we're going to be going to Middletown. We're trying to go to different communities in the county,
Right.
but anybody is invited, certainly from surrounding areas and whatnot. Middletown's not too far.
No, not at all.
Yeah. So it's going to be at Sunny Hill Community Center. We'll have information also for you on the screen, and you can also register for that event online, and it's a free event. When you register, you can also be entered into a drawing to win a free self-care package, like a basket. We thought that would be a nice thing to offer, and t-shirts and things like that. But we'll have resource people there as well, so people who are dealing with grief and loss, to kind of know where they can go.
Well, it's a very compelling and sobering topic, but very, I think people will see that there are resources, there's hope available to any age, correct?
Yes, open to any age. I think I forgot to mention that we do it on the World Suicide Prevention Day, which is September 10th. And the walk starts at 6, or the whole event starts at 6:30. It's kind of a sunset event, so we walk with sort of battery-operated candles in remembrance of those that we love, and we'll have hope squads in the area. Those are some of our partners in the coalition. Those are young people in high schools that work with advisors and work on mental health for their school community. They'll be there assisting. You can write a name of a loved one, a first name, on a yellow ribbon and tie it along a fence there at the park. And I hope, this is my idea, I'll just tell you, that I want to do the chalk outline of the word hope, and that's where people will tie their ribbons, because as we learn more about suicide prevention, as we come together as a community to support each other, as we find out our resources, there doesn't have to be repeats of this happening. We can all learn more and look out for each other.
Well, thank you so much for spending this time with us today on Feelin Good. And we'll keep in touch.
Absolutely, yes. I hope to see you at the walk.
I hope, yes. I'll put it on my calendar, actually.
Good.
And I hope that all of you in our audience have been, as I mentioned earlier, enlightened by the resources we've discussed, the programs we've discussed, and we hope that you are feeling good in body, mind, and spirit. So we look forward to seeing you soon. Bye for now.